Hi, today we are going to talk about chemotherapy side effects, particularly mouth sores. I've mentioned before that chemotherapy targets rapidly dividing cells, and the lining of our mouth, the lining of our throat has those rapidly dividing cells that some chemotherapy can target and cause mouth sores. Why is it important for me to educate you on chemotherapy side effects? The first reason is I want to prepare you to know what to expect. And this will reduce fear and the fear of the unknown of what will happen when I start treatment, or for your loved one if they are starting cytotoxic chemotherapy medication. It will help you identify those side effects and seek treatment before they become severe. And it's very important for you to report those side effects early so that it can prevent complications, and which could eventually delay your treatment process. It will also improve your quality of life, because once you know how to prevent these side effects, it will help you to be vigilant and um, do those things that will help prevent these side effects from happening or from even becoming severe. So the reason for this recording is just to help you and your family, your loved one, become vigilant and to know what to expect to prevent complications or minimize the occurrence of this side effect. So let's dive in and talk about mouth sores, which will be our first side effect that we'll talk about in the next few weeks. This first picture here shows some mucositis or mouth sores. This is a severe case, but it could range from just redness and pain in the mouth to some white coating on the tongue or sores like this. So you really don't want to get to this point, because when you see this, nutrition and hydration will be a problem if you experience mouth sores such as this. This slide here just talks about what mouth sores are, and like I said earlier, some chemotherapy drugs, not all of them, can cause mouth sores, and it's very important for you to talk to your doctor before starting treatment to kind of determine, for them to talk about the drug that you will be getting and what side effects to expect. But I want to mention that before any chemotherapy treatment, make sure your mouth health is good. Go visit a dentist to make sure you don't have any teeth that needs to be pulled, or you don't have cavities that needs to be filled. Just go for a cleaning, and your dentist will evaluate your mouth, the integrity of your mouth, to make sure you're good to go. So yeah, like I said earlier, having this mouth sores can prevent you from eating and drinking, which is very important during chemotherapy. Some signs and symptoms of mucositis includes redness and swelling in your mouth, mouth pain or burning sensation, ulcers or open sores, dry mouth, difficulty chewing or swallowing, changes in taste, the taste of your foods. You notice that after chemotherapy, food will not taste the same, and this is because chemotherapy changes your taste buds, a term called dysgeusia. But again, good oral care can help that. Bleeding of gums and teeth can happen too. So those are some of the signs and symptoms of mucositis. So preventing occurrence of mouth sores is very important. Why does it matter? It matters because it decreases the amount of pain and discomfort that patients experience during chemotherapy treatment or even radiation therapy. And reducing the amount of pain and discomfort will help maintain nutrition and hydration, because this is very important, like I said earlier, during treatment, because we encourage patients to maintain a high level of nutrition and hydration. It lowers the risk of infection, because if you have this open sores, there you could get a bad infection in your mouth or even in your bloodstream. So it's very important to take care of mouth sores if they occur, and overall improve the quality of care, because you're going to be maintaining nutrition, hydration, pain, and minimize discomfort during treatment. I think I already kind of went through this slide before starting chemotherapy or radiation therapy. Make sure you schedule a visit with your dentist, treat existing dental problems, practice good oral hygiene, make sure you're brushing your teeth at least 2 or 3 times a day, and discuss any health concerns with your primary care doctor or with your oncologist before starting treatment. This slide talks about daily mouth care. You need to brush with a soft brush. Avoid using rough brushes, but stick with soft, gentle toothbrushes. Brush before and after meals. Floss if you can, but be careful not to cause any damage to your gums, because that's another source of infection if you're damaging your gums. Keep lips moisturized, because if you have any cracks or breaks on your lips, those would be hard to heal. And stay well hydrated. By staying well hydrated, I mean make sure you're drinking 7 to 8 cups of water a day, if you can, or any fluid that will keep you well hydrated. This slide here talks about some of the treatments that you use or recommended things to do to prevent occurrence of mouth sores or to treat them. We recommend for you to use a salt and baking soda rinse. You mix 1 teaspoon of salt, 1 teaspoon of baking soda in 4 cups of warm water, and just use that as a rinse 4 to 6 times a day. This will make your mouth moisturized. It will make your mouth basic and prevent buildup of bacteria. So what you do is you just swish and gargle, for 30 seconds and spit it out. So this is a really good home regimen to use, but especially before meals and at bedtime. Baking soda and salt, it loosens up any thick mucus and decreases irritation in your mouth. But if you have really bad mouth sores, then you probably need some prescription medications, and we'll talk about that in the next slide. But it's very important to avoid any alcohol-based mouthwashes. So if you're buying mouth rinse from the store, just avoid ones that contain alcohol. Just buy plain ones that will not be too rough for your mouth and gums. So this slide just talks about recommended food choices. Make sure you're choosing foods that are soft to chew. Avoid any hard or crunchy foods. Stick to yogurts, pudding, soups, smoothies, protein shakes. If you have, pain in your mouth or if you have irritation, avoid spicy foods, too much acidic foods, such as acidic fruits, like oranges, lemons. Avoid too much salt. You want to choose like bland foods that will not be irritating to your mouth. This slide talks about some of the things you need to notify your healthcare provider about. If you have a fever of 100.4 or higher, this could be a sign of infection. So you need to call your doctor so they can see you and treat you sooner than later to prevent worsening infection. If you have severe mouth pain to where you're not you're not eating or drinking, or if you have bleeding in your mouth, you have white patches, which could be a sign of yeast infection in your mouth, or if you have any signs of dehydration such as lightheadedness, dizziness, low blood pressure, or fainting, or very dry skin, you need to notify your healthcare provider. That way they can call you in for some IV fluids or to evaluate you. So some of the treatment options that we have for to treat mouth sores, I mentioned earlier, the best preventative one is the salt and soda swish, but sometimes we may have to send in some prescription medications. This one that's called oncology swish, this has, numbing medicine as well as um, uh, medications to help with healing. Uh, Pain relief is very important as well with mouth sores. That way it can help you eat and drink. Lidocaine is one of those numbing medications that we use. Antifungal medications such as nystatin can be prescribed. But it's very important, again, to reiterate the importance of nutrition, the importance of hydration, the importance of taking foods that are rich in proteins, because those are bodybuilding nutrients, as well as vitamins to increase your immune system, and as well as carbohydrates to help with energy and giving you the strength to be able to go through the treatment. So it's very important for you to stay well hydrated, and increase nutrition, and it's good to start this earlier on before even pursuing chemotherapy treatment. So yeah, so these are the treatment options that we have for mouth sores. So the key takeaways for this education is know your mouth, know how your normal mouth feels. That way it will help you know the changes that are happening. Seek help sooner than later. Stay very vigilant about your oral care, and report symptoms as early as possible so you can receive the appropriate treatment. Most side effects can be prevented, can be minimized, and can be treated effectively when recognized and reported early. So stay vigilant with your health. Be a part of the treatment process. Be your own voice. Caregivers, be the voice of your loved one. Don't be afraid to report these symptoms, because you will be helping your healthcare providers take good care of you. So participate in your care, and this will improve your quality of life as your loved one goes through treatment. So yeah. So that's the end of the mucositis education. Subscribe to this channel so you can learn more about chemotherapy side effects. The next topic will be nausea and vomiting in the next week or two. So we'll see you then, and thank you for listening.